And generally speaking, you can roughly draw an equal sign between pain and qi and blood stagnation. All right, draw an equal sign between pain with qi and blood stagnation, because the Chinese saying is, where there is pain, there is stagnation, and where there is stagnation, there is pain. So basically the two goes hand in hand. All right, and the difference is the qi type of pain, qi stagnation type of pain, tends to be a little bit more dull, a little bit more diffuse, tend to cover a more general area. And the blood stagnation of pain, type of pain, tend to be more localized. It tends to be at a certain fixed region, and it tends to be a sharper stabbing pain. Okay, and obviously both can occur at the same time. Okay, so a lot of the herbs that are specifically used to treat pain belongs in the category of herbs that move the blood, invigorate the blood circulation, and also eliminate the blood stasis. Okay, and in turn, the pharmacology of these herbs generally is that these herbs have excellent analgesic effect to relieve pain, and they also have excellent anti-inflammatory effect to reduce the inflammation and swelling. All right, so usually what happens is herbs with anti-inflammatory effect don't directly relieve pain, but the mechanism is that when somebody suffers an injury, let's say a basketball player sprains an ankle, so what happens is there's a huge swelling around the neck, the ankle area. So what happens is the swelling then causes pressure on the nerve endings, and that then causes a lot of pain. All right, so by using anti-inflammatory drugs or anti-inflammatory herbs, you are then able to reduce the swelling and inflammation. That will then allow the blood circulation to come in to clean up the area, to repair the damage, okay, to facilitate the healing. And also, once the swelling and inflammation comes down, it no longer presses the nerve ending, and that's also how it relieves the pain. Okay, so the analgesic drugs or herbs directly relieve pain, and often they work by interfering with the pain signals, interfering with the nerve transmission of the pain signals. Okay, so for example, drugs like opioids or herbs like yanhusuo would work on the nerves to stop pain. Okay, then you have herbs such as ruxiang and moyao, mastic and myrrh, or drugs like NSAIDs that are anti-inflammatories. Okay, but even though they're anti-inflammatories, they reduce swelling and inflammation and will then indirectly help to relieve pain. Okay, so that's the difference between the analgesic and anti-inflammatories. All right, as far as this formula is concerned, the chief and the most important herb is yanhusuo Corydalis. All right, and for those of you who specialize in pain management, you probably have heard of or use this herb on a regular basis. And in fact, last year, interestingly, there is a great surge in the people using this herb, in part because it went on TV. Well, I mean, not the herb going on TV literally, but Dr. Oz had a TV show, and he talks about Corydalis for treating pain. So all of a sudden, you see a lot of practitioners start to order this herb and using this herb a lot more. And that's somewhat interesting because you would think we are the practitioner, we should know this herb and should know how to use this herb. But interestingly, it takes a TV show to send the signal or information to the patient, who then come to acupuncturists to ask the use for this herb. So to me, that means we're not doing a good enough job to educate the patient and to educate the general public. Okay, because if we do a good enough job, this should be something that most of us know already and most of us use on a regular basis. Okay, but in any case, I think it's a good publicity, because it's a little bit more exposure of how Chinese herb can be used to help the patients. All right. So anyhow, yanhusuo is the most important herb in this formula because it's a great herb to help to treat pain. Okay, and once again, the effect of yanhusuo is very broad, so it helps to treat pain associated with musculoskeletal system and also with the internal visceral organs. And I would say overall, it's probably a little bit stronger for the internal visceral organs. All right. So for that, this herb is also then paired with ruxiang and moyao, which is mastic and myrrh or frankincense and myrrh. These two herbs also have very strong analgesic effect. and generally speaking are more effective for external trauma type of pain. Okay, so between these two, basically you have an herb that greatly relieve pain for the internal organs, two herbs greatly relieve the pain for the external tissues, and then Dangui and Sengma are to help with blood circulation and also to open up the peripheral vasodilation to help with circulation. All right, so this is one of the best formulas specifically just to help to treat pain. Okay, pharmacology-wise, Yanhusuo has great analgesic effect. It's great for treating the neuropathic pain. Okay, it definitely has shown great synergy when combined with electroacupuncture. Okay, so what a lot of people like to do is to use this herb and acupuncture at the same time. All right, so what they usually do is after they finish doing the interview with the patient, they gave the patient some herb first, especially ones with Yanhusuo or Corydalis, and then they have the patient go to the treatment room and do acupuncture, right? So what happened is about half an hour later, 40 minutes later, when acupuncture treatment is done, generally by that time, the herb's effect has already kicked in, all right? Acupuncture effect obviously is also in full effect, all right? So at this point in time, you have herbs working very well, you have acupuncture working very well. So if you are treating somebody who has severe pain, acute pain, stubborn pain, hard to treat, whatever the case may be, now you have attacked it from multiple angles, and generally speaking, the pain is a lot better. All right, so right when they walk out of the clinic after the first treatment, they feel a lot better. And you want them to walk out of the clinic feeling that you made a difference. All right, so psychologically, the patient will feel much more positive and will be much more likely to come back for a second treatment and third treatment and take the herb on a regular basis. All right, so this is very, very important for patient compliance to feel the pain relief when they walk out of the clinic. Okay, compared to if you tell them, okay, if you come back every week for 10 treatments, your pain will feel a lot better. A lot of time they won't come back for the second treatment. All right. Beyond that, pharmacologically, they have been shown that the raw herb, in comparison with morphine, is about 100 to 1 as far as analgesic potency goes. All right, so herb as a botanical plant obviously is much weaker than morphine on a weight-to-weight comparison. Okay, but if you use the herb in extract form, if you use slightly higher dose, you do get quite a significant effect for relieving pain. All right, one benefit also is that use of the herb will not cause physical dependence. All right, so for that, you can continue to use the herb and you don't have to worry about the patient being physically or mentally addicted to the herb. Okay, but the herb may cause tolerance, and that generally occurs after about 2 to 4 weeks. All right, so what that means is whatever herb, whatever formula that you use that has Yanhusuo, if you use the same formula day in and day out, usually after 2 to 4 weeks, the patient may come back and tell you that the formula is not working quite as well as it used to. All right, so then you may either have to increase the dose to compensate for tolerance. Maybe you need to do acupuncture on the days that they come. Okay, so give the patient a day off here and there. Or if the patient has a job-related or certain activity-related type of pain, right? So maybe they're construction workers, and on Monday and Friday when they work, their pain gets worse, so they need to take something. But on weekends when they rest at home, the pain is not so bad, so maybe they can take a day or two off. You know, that way they don't build up tolerance to the herb, and the herbs will continue to work without you having to increase the dose.